Welcome to All About Autism, where we explore all aspects of autism from the inner depths to the outer limits. I'm Leah M. Hill, an autism advocate, author, and educator. I have an MBA, and I teach in a program for young people with intellectual disabilities. I am also an intuitive medium, and part of what I do is help people in the autism community connect with those on the spectrum in a heart-centered and compassionate way. This show brings awareness, education, and resources for everyone. Thank you for joining me on this journey that is all about autism. Hi, welcome to the show. I'm Leah Hill. And today's topic is probably not one that you've heard of before. Today we are going to explore autism and chiropractic care. Now, typically we think of treatments for autism as being things like speech therapy or behavioral therapy, and we think of only going to a chiropractor when we have neck pain or back pain. So many people, including myself, have never heard of any connection between chiropractic adjustments and how it can help people with autism. But as I started talking with people who are in this business, I started hearing some really intriguing stories and results with being able to help kids with things such as speech delay. For example, where a child who wasn't speaking began to speak after receiving chiropractic adjustments. That was pretty amazing. Also being able to help with other issues with autism that are very typical symptoms associated with autism, like anxiety, insomnia, hyperactivity, and also eye contact. So I was so intrigued by this that I just decided to dedicate a show to this topic. Now, you might be a little skeptical of chiropractic care by itself because the approach to treatment is very different from traditional medicine. But chiropractors do have to be licensed professionals, and according to the American Chiropractic Association, the actual educational requirements for doctors of chiropractic are more stringent than many of the other healthcare professions. You typically have to go through 4 to 5 years of a pre-med degree first, and then you have to apply to an accredited chiropractic college, which is another 4 to 5 years after that, including getting all of the clinical training. And in order to practice in the state, in each of the states, you need to get a license as well. So finding research about this connection between autism and chiropractic care was pretty challenging. I looked around on the internet. I really couldn't find anything clear or usable that would help us, find out the scope of this and how it can work. But I did find some documented case studies that were done by chiropractors around the United States who treated kids with autism. And what they were able to document is improvements in the kids that they treated with things like toilet training, eye contact, cognitive speech, hyperactivity, and they documented that some of these kids were able to transition into mainstream classes when they were previously in special ed classes in school. So today we are going to talk to and meet a chiropractor who treats kids with autism as well as other neurological issues as well. We're going to meet some of the parents who bring their kids for chiropractic care and find out what results they've seen in their children. And we'll also get to meet some of the kids as well and find out how they like it too. So stay with us for what should be a very intriguing show. So to help us understand this connection between autism and chiropractic care, we are here in Beverly, Massachusetts with Dr. Jamie Engel of Aligned for Life Chiropractic. Hi, Dr. Jamie. Thanks for having us here today.
Thank you, Leah. Thank you for being here.
Thank you. And I just wanted to see if you could start us off with a little bit of a brief background about you and how you got here.
Sure. I actually went to Palmer Chiropractic College in Northern California, and also before that I studied at the University of California, Davis. I was a pre-medical student, so I majored in biological sciences, and I emphasized in neurology and physiology. And I was on my way to pretty much go to medical school. I still have the degree, and I worked at the hospital like a good intern when I was a pre-med student, and I hated it. All my life I've worked with kids, and I wanted to be a pediatrician, my whole life. And when I finally got to the hospital and working with the children, I got frustrated. And it was just sad to see these children. They just weren't getting better. And I got really frustrated. And so I went back and looked at the internship list and saw chiropractor. And I never really thought about it. I have been getting adjusted since I was about 14, 15, so I'm familiar with chiropractic. You know, I was so young, I didn't really know why I was getting adjusted. And I started an internship there, and I had a blast. I saw some amazing things happen, and I maxed out my internship with the doctor there and decided to go to chiropractic school. So.
Wow, that's an amazing change of direction, but still, you know, in the healthcare field, in the medical community. But, you know, what we'll see during the show, too, is that you have such a passion for working with kids, and they just adore you and love you so much. It totally makes sense that that's what you specialize in, although you do, I know you do treat adults as well.
Yes, I always say I don't discriminate. I do see big kids as well.
Yes. And, you know, many of us who, you know, come to you as an adult or already in pain or maybe have never had chiropractic adjustments before, and we're kind of like not knowing what to expect. So, so that is really helpful for some of us who have already done a lot of the damage, you know, to then try to, you know, undo it.
Oh,
Yes.
yeah, absolutely. I always say my patients are kind of like onions. You have to like take especially as an adult, you have to take those layers off and find out that root cause of the problem, you know.
Yeah, so it's amazing what you teach children, you know, starting from a young age, how to take care of their bodies, you know, so before it's too late and they end up in pain.
Absolutely. And it's like your teeth. Once you have pain, it's way late in the game. Whereas if you just maintain the health of your teeth, you don't have to worry about losing them.
Right.
You know, it wasn't that long ago that dentistry wasn't even that popular, and probably it was an old age thing to have your teeth fall out. Whereas, you know, I believe that hopefully one day we get to the point where arthritis in a joint is not an old age thing anymore. It's common, but it's not necessary.
Wow, that's fascinating. So tell us how this chiropractic care can help people or kids with autism. How does it help the spectrum?
That's a great question. Like I said, my background's in neurology, and what always interested me about chiropractic was the neurological component. And so when patients come in, I really educate them about the neurological component. And so I'll discuss that a little bit here.
Sure.
So with chiropractic, we look for misalignments of the bones, which we call subluxation. And what it means is a misalignment of the joints. And back in the day, chiropractic, the theory was that the pressure on the nerve is what compromised the nerve. And it compromised the nerve flow. And they did some studies at the University of Colorado where they did some nerve conduction velocity testing, and they showed that it compromised about 60% the pressure of a quarter. But what interested me more, and I never understood, well, then why do we help children and even adults with neurological issues like ADHD or even anxiety? Because now they're finding out that the motion of the spine and the movement in those joints actually stimulate your brain. And I know I was talking to you earlier about when you're born, you have a bunch of neurons, which is just another word for brain cells. And within those first 2 years of life, those neurons make connections. And that's why, you know, you see those 2-year-olds going and getting into everything, is because the movement of their spine stimulates the brain and helps the brain develop by making those connections. Now, here's the interesting thing. Most of the stimulation to the brain comes from your spine. And interestingly enough, they say most, which is also called proprioception, so that's good stimulation to the brain, comes from that upper cervical joint. And here's what I've noticed clinically. Many of the children I see with neurological disorders had some kind of birthing trauma. And I think what a lot of adults don't realize is the pressure that it takes for a C-section or a vacuum or forceps birth can put a lot of trauma on a neck that literally, first of all, we don't have a neck curve when we're born, and our muscles aren't developed yet. So it's really easy to have trauma to a child, a baby's spine. And a C-section has as much pressure as holding a baby by its head. So what happens is that joint can get misaligned and impede that natural movement, because that's what subluxation does. Actually, the first sign of subluxation is not pain. It's a real misconception. It's actually stiffness, lack of motion. Kind of like, yeah.
Wow, which is something we would feel as adults, but in a child who can't express that, they don't know. They can't express that. This is fascinating. Mm-hmm. Fascinating.
So with one adjustment, and normally, like you saw when I adjusted Callie, most of the time I'm checking that upper cervical region, which is how we see some amazing things happen. Children start to speak again, or speak for the first time in their lives. Ear infections drain. I mean, I've seen just about everything. And even in adults get more energy, or they sleep better. It just has to do with that nervous system, calming that nervous system down.
Okay, and as you typically explain as well, this isn't just a one treatment, one-time visit kind of thing. It's something that is what is the scope for a child, even a child on the spectrum or a child that comes to you? Is it something that is like lifelong treatment, or is it for a period of time?
Well, here's the thing, which I can get frustrated with when patients say to me, "Well, once you start seeing," or someone who wants to know about chiropractic, "Well, once you start seeing a chiropractor, you have your whole life." And I said, "Well, I hear the same thing about your dentist and your hairstylist. Mm-hmm. Once you correct something, you can get the best haircut in the world, but
That's
if you don't
true.
maintain it, what's the point?"
Right.
We know that we're supposed to take care of our heart. We know we're supposed to take care of our hair and our nails. Women go all the time, get their hair cut and their nails done. But what people don't realize is we need to take care of our spine too, or else it's going to literally deteriorate. And that's what we see so commonly. Arthritis is so common. Deterioration of the spine is arthritis. Mm-hmm. If you keep good, healthy motion by keeping a proper alignment, those are things that don't have to happen.
Right. Wow. Thank you so much, Dr. Jamie. This is just an amazing experience. And, even the way that I introduce the show is like, we've never heard of this. We've never heard of any kind of connection between how chiropractic adjustments can help people on the autism spectrum. But one question I did want to ask is, do you think it matters if the person on the spectrum comes to you as a child or as an adult? Is it similar, or is it a totally different ballgame?
I mean, the earlier we catch it, the better. With subluxation in general, the earlier I can catch it, the better. Your spine will completely compensate to the head posture. Mm-hmm. And so if we can address that before it compensates to lower parts of the spine, it's much better for stimulation of your brain. Mm-hmm. But the sooner you get it before the brain makes its full connections, the more stimulation. It's really interesting. I adjusted this little baby, and she had a lot of illnesses. And I remember right after I adjusted her the first time, the upper cervical, she starts doing this. She couldn't get enough stimulation of her brain. Now, that rotation of the head comes from the upper cervical joint. Mm-hmm. So 90% of that. And so she just couldn't, her brain just couldn't get enough. And she just kept turning her head. And the mom was like, "What is she doing?" I said, "Well, she's getting her brain stimulated for the first time in her life." And it was unbelievable. Yeah.
And this was actually an infant, a small baby.
Yeah. I mean, I've adjusted babies. I've checked babies, since they were born. It's unbelievable. These are, we always say our chiropractic children, they don't get sick. They don't get ear infections. They sleep through the night. It's a whole other ball game. I love when I see a woman through her second pregnancy, and she's like, "Where were you my first pregnancy?" And this baby is so different. And it's unbelievable what we see with the change with chiropractic care. And that's why I really love what I do. You can come in here any day and we're smiling, and it's just a big party in here. And because everyone is just functioning so well. Yeah, they're not in pain. That's the easy part, but they're sleeping. They have better energy. It's a whole other life. And why wouldn't you want that? So.
Well, sure. Yes, absolutely. And why wouldn't we want it for our kids as well? Absolutely. Definitely. Just, it's so evident about, not only in the patients that you see, but in you, in your energy and what you bring to your practice as well. And there are so many people out there who don't love what they do, and it's really nice to meet someone who really does, who's so passionate about her work. So thank you so much, Dr. Jamie. So we're here with Adrienne and Will Monks, who are parents of some of the kids here who received treatment at Align for Life Chiropractic. Hi, Adrienne. Thanks for being here.
Hi, thank you.
And Will, thank you for being here too.
Good morning. Thank you for having us.
Good morning. So I wanted to talk to you about the experience that you've had with your kids prior to coming here at Align for Life Chiropractic. Who wants to take that?
Sure. Liana Monks has been in early intervention for probably since she was 10 months old, and she's had some speech delay. Mm-hmm. now. And my other daughter, Callie, had when she was an infant, she had torticollis, which torticollis is like a muscle spasms of the neck, kind of like a little tilting of the head. The pediatrician noticed, so then we ran into. I don't know if you want to elaborate more on why we came here.
Sure, please do, Will.
Well, Dr. Jamie's mutual friend, we have a mutual friend, and I actually bumped into them outside of my office about mid-April. And she said that she specializes in working with young children and some developmental issues, and I thought it was a perfect fit. I immediately went into my office and emailed my wife her website and told her to book an appointment, and it's been the best thing we've ever done for them. So.
Really, that's amazing, because so many parents in your position that have these, labels or diagnoses with their children, and they don't know what to do. They don't know where to go, really. So what we wanted to do on this show was to offer that kind of information of like what resources are out there and what people can do. So what kinds of treatments do your kids get here?
Just regular adjustments. Just they go on the table and Dr. Jamie will feel and do the regular adjustments, pretty much. There's no home exercises or anything that they receive.
Really, that's wonderful. There's no other extra credit things that they need to do or anything like that. That's great. So what are some of the results that you've seen in your girls since coming here?
Increased energy. Liana has a little bit of a speech delay, and we've noticed she's picked up on some words. It's overall improvement of health. Dr. Jamie has suggested getting them started with omega-3s and fish oil, and we think that stimulated their brain development, and it's been very positive.
Wow, that's great. And as far as that speech delay issue, does that mean that she wasn't talking or wasn't able to form speech at all, or what was that like?
There was some small words, but it wasn't as spontaneous. It just picked up, I would say, right after we came here, right around that month, and now it's forming 2 words, 3 words. Still, she's a little bit more slow to develop, but the words are really picking up. We're really seeing more focus, more improvement with Liana. It's amazing.
Wow, that's wonderful to hear. And so if there are parents out there watching who might be thinking, I don't really understand what's going on with my kid. I don't know if there's what to do. I don't know where to go. And I might be a little nervous about taking my child to see a chiropractor for this. Do you have any advice or anything that you'd like to say to them?
The adjustments are painless. I mean, they take all of 30 seconds. Right. And they're very happy. It's been a positive experience. They're very happy after they get adjusted. And I think it's enabled them to become more comfortable when they go to see their primary care physician. They get used to seeing a doctor, and it's fun to them. My daughter Callie loves coming in here, and when we pull up in front of the office, she's ecstatic. She knows she's at Dr. Jamie's office, and she runs right in and onto the adjustment table, and it's great. It's really exciting to see.
Yeah, it is. Yeah, it is exciting to see. She'll want to adjust me at home and pretend to adjust me. I think she's going to be a chiropractor herself.
That's really great point, because now I'm remembering when I was a kid, going to the pediatrician's office. It was, the white walls, very sterile environment. You're all on the big table, and it's a little intimidating and a little scary. So that's a really good point of just getting kids used to being able to connect with doctors and speak to doctors as well. Right. True. Wow, that is wonderful. Thank you so much, Adrian and Will, for being here with us and sharing your time with us here today. We really appreciate it, and we really appreciate that you've, shed your perspective on this whole topic and shared your experience with us. Thank you so much. Thank you. So now Dr. Jamie is going to demonstrate an adjustment with Liana, who is, how old is Liana, Adrian?
28 months.
With a 2-year-old child.
Are you ready, Liana? So with a 2.5-year-old, they obviously don't need that many adjustments. It's normally just like 1 or 2. And with Liana, it's only 1 usually. And it's a tough age, because either they want me to adjust them or they don't. So there she goes. But with a child, it's only a couple adjustments. They haven't been subluxated that long. So, Callie, would you like to get adjusted?
Yeah.
Okay. Which is awesome. Lay on your back. Go ahead and lay on your back. Show what you normally do. You want to do it the opposite way? Well, I could also do it this way. So with Callie, let's see if she lets me do it. The motion is extremely small. Now, she doesn't really have anything today. I can actually feel her spine feels really good today. And the adjustment is an extremely small adjustment with them. So there's nothing for me to adjust. So I'll just explain what I would usually do. With a 2.5-year-old, it's kind of amazing. Even with infants that I adjust, you put them in the position, and sometimes they just do it themselves.
Wow.
And it's about, if I demonstrate, it's only about from here to there. And it's the smallest little motion, and it's unbelievable, the response we have.
That's
from that small
amazing.
little motion. Yeah.
And it reminds me of something you had said to me a while ago about, remember when we were little kids, before when you see a baby just wake up, what's the first thing they do? Stretch. And it's like they just do it naturally. They know what their body needs.
Yeah, exactly. I just adjusted a 1-year-old the other day, and she laid back down after adjusted, like, okay, do that again.
Wow.
Yeah, it's unbelievable.
Yeah, because it feels good, it makes them feel better in their body, and that's great, and they love it.
Mm-hmm. Absolutely.
That's great. So, Dr. Jamie, can you explain what these chairs are here and what they're for?
Absolutely. They're actually wobble chairs. We use them as a rehabilitation tool in our office. Besides being a whole lot of fun, as you can see, with the kids wobbling, they absolutely love it. It's also great for both children and adults. It stretches your low back, strengthens your low back, helps keep the disc healthy, but also neurologically helps stimulate your brain. Through
I didn't know that.
Yeah, through proprioception. So it helps wake up your brain and stimulate your brain. So when we have children with different neurological disorders, we actually recommend a wobble disc for them to sit on during homework time, and we have noticed test scores improve, focus ability improves. It's unbelievable the changes we see even just with the disc.
Wow, do I wish I had that when I was in school. Oh, that's great. Well, the kids look like they're having a great time on them. Can you guys show us how to wobble?
Yeah, show us how to wobble. You got it, Callie? There you go.
Okay, all at once. There you go.
Good job, Callie.
So I'm here with Tammy O'Brien and her daughter Erin to talk about their experience of coming here at Align for Life Chiropractic. Hi Tammy, thanks for being here.
Oh, thank you for having us.
Thank you. So tell us what symptoms and issues your daughter Erin had before coming here.
Erin had tics that she has. She also she was having issues in school. They wanted to have her tested because she was having some processing issues. And she was having problems running. So she was in soccer and she would have a lot of problems running right. She looked like there was something stuck in her shoe when she ran. She just couldn't run. And those were like her main issues, and a lot of body aches,
Wow.
headaches, stuff like that.
Wow. So then you brought her here to see Dr. Jamie, and what kind of results have you seen? Those are pretty unusual symptoms.
Yeah, we've seen some pretty good results. Within the first chiropractic adjustment, the next day she went to soccer, and she was running completely normally like the other kids.
Oh my goodness. After one adjustment.
It was a lot easier to run and it just felt better.
That is amazing results. Wow. So after you saw that kind of results, I bet you were convinced.
I called up Dr. Jamie and left a message with her on her answer machine at the soccer while I was at the soccer game saying, I can't believe what I'm seeing. Wow. This is incredible.
Oh, that's amazing.
Yes.
So, Erin, what's your experience like coming here, regularly getting adjustments? What does it feel like to you?
Well, my adjustments when I first got the first one was okay, and I felt great. It got a little bit sore, but I just needed to get used to it. My body was really stiff from before, and it feels great every time I get adjusted. And Dr. Jamie is like the nicest person I've ever met.
She really is, and I'll tell you, she is someone who loves kids. She just loves working with kids, and she's so passionate about her work.
She's always talking about kids and stuff.
So how has, do you think these adjustments have helped you with your schoolwork as well?
A lot. I used to space out sometimes during like the middle of class, and then I'd be like worried because I didn't know what I was supposed to do. But after I started getting adjusted, I started focusing more, and I was getting better grades.
Wow, that is really incredible results.
We canceled the testing for her because we didn't need it anymore.
You canceled the testing that would have told you if there was some other issues or other kind of labels you would want to put on Erin, and just said, you don't need it?
We didn't need it. She just was doing well in school. She was able to focus, and it made just a big difference for her.
Wow, that's wonderful. And is there anything, Erin, that you need to do at home to, in addition to the adjustments when you come here, or is it just you can leave here and go on with your life?
Well, when I go home, I always need to do my stretches, and I have to put out rolled towels and lie on them for a certain amount of time, and basically just keep doing it every night until you get better and better at it.
Wow, that's great. So it takes maybe a few minutes a day, maybe 5 to 10 minutes of sort of homework with that, but look at the results that you've gotten. So, Erin, do you have anything else you'd like to say to other kids like you who might be thinking about or wondering if, what it's like to get an adjustment?
Well, it's really not scary, and in some movies or things, they'll make it look like chiropractic is scary. It's really not, and it helps you so much, and later on in life, it just, you don't have, when grown-ups or kids, they didn't really have chiropractors and didn't really go as much, and that's why most of them kind of complain about stuff hurting.
Yeah, that's true. People like me, you just mentioned me, who didn't, and I was very typical of Dr. Jamie's adult patients where I didn't go to a chiropractor until I was in pain. And she said, by that time, it's kind of, you have to undo all the years of what you've done already. Whereas if you started when you were a kid, your body grows with it, and it grows in a right alignment in a way for you.
It started when she was very young. Because by the time we came, she had already had so much trauma.
Thank you so much, Erin and Tammy, for sharing your experience here with us and educating us on how this works and how this can work for someone like you who had so many, a variety of issues and that didn't seem to be connected, but yet all fit together so well with chiropractic care and, as you mentioned, the nutrition and the homework exercises, and doing all of that as well. It really is a part of a holistic health practice for you.
Yes, we love Dr. Jamie. I wish we had been coming here a lot sooner.
Yeah. I just think for anyone who thinks this doesn't work or it's just for money or something like that, it's not. And you'll regret if you don't go, because it makes a huge difference.
I agree. Thank you so much.
Thank you.
So, Dr. Jamie, can you share an experience or a story that you've had with a child on the autism spectrum?
Yes, one in particular does come to mind, which is probably my favorite story. A few years ago, I had the pleasure of working with a brother and sister, about 7, 8 years old, who were both autistic. And the mother brought them in, and she didn't really talk that much to me. Sometimes it would just be like kind of social, and even during progress checks, I would say, "Oh, how are the kids doing?" "Oh, they're okay, they're fine." Nothing really in detail. And I remember one particular day, the children came in, and it was amazing because the young boy would just jump on the table, even if there were people in front of him, it was so cute. He would just jump on the table, face down, and he just loved it. And she said, "Jamie, I was approached by my son's teacher." I was like, "Oh, is everything okay?" And she goes, "Oh, yeah, everything's fine, but apparently, he is very calm on Thursdays." And the teacher was baffled and had no idea why. And then they started doing journals. And in his journal, he wrote, "I love my chiropractor."
Oh my gosh.
And she realized with the teacher that he gets his adjustments on Wednesday afternoons. And
so by the time he went to school Thursday, he was totally feeling good and in alignment and able to focus?
Yep, and his anxiety decreased, just calmer nervous system. And I always say, I can't promise that's the end-all cure-all, but if we can make that little bit of difference with these children, it just goes so far, It was such a beautiful thing to hear.
That is. Thank you for sharing that with us. And it's such a beautiful example of all the many ways that your work can help people of all situations and all issues and all, because as we know, the autism spectrum is such a wide spectrum. No two people are alike and no two kids are alike and showing the same symptoms. So it's really amazing that you can work with whatever issues they have, or if they aren't diagnosed yet with autism and they have still some neurological issues. So it's wonderful, really wonderful. Thank you so much for having us here today, Dr. Jamie. And I just want to know, if someone wanted to contact you and to find out more about you, how would they be able to do that?
So if someone wants to contact us, the easiest way is to give us a call and schedule a consultation, or visit our website for some awesome information, www.alignedforlifechiropractic.com, and they can schedule just a consultation with me, and we can see if we can help you and your child.
That's great. So even someone who's not ready maybe to commit or to bring their child in, just wants to get some more information, they'd be able to just observe and find out what's going on.
Oh yeah, absolutely. Consultations are always free in my office, and I enjoy talking to patients. I've had patients interview me. I love it. I mean, I'd feel the same way if I was seeing any specialist for that matter. I definitely encourage patients to come in, talk to me, and see if I'm a good fit for them. Absolutely.
Yeah, that makes total sense. And also, I know you do some workshops and presentations. What kind of things do you talk about?
Oh, I love talking about anything health and wellness, and you can see that in my blogs, anything health and wellness. I mean, I've done talks from nutrition to even golf for that matter, and I love doing it. I just talked at Salem Hospital. I did a little half-hour workshop, a health workshop. That was wonderful, and yeah, if they want any information about that, they just contact me, and I'd be glad to come down and do a health talk, even on nutrition or healthy movement. I've done just about every type of topic of health.
That's great. And you found so many ways to share your gift with the world. Thank you so much, Dr. Jamie. I really appreciate you having us here and taking over your office today.
Thank you so much, Leah, for being here. It's been wonderful.
All right. Thank you. And please join us again next time on All About Autism with Leah M. Hill.